Hi there, kids and parents. Welcome to the University of Maryland Children's Hospital. Going to the hospital for surgery might feel a little scary, but don't worry. We're here to walk you through every step so you know exactly what to expect. Let's take a look at what happens when you come in for surgery. When you arrive to the hospital, you will check in at the main hospital registration desk. If you parked at a University of Maryland garage, don't forget to bring your ticket stub for a discounted parking rate. Before your surgery, a nurse will call you and your family. They'll tell you what time to arrive at the hospital and remind you when to stop eating or drinking. That's called being NPO. It just means your tummy needs to be empty before your surgery. You can bring some comfort items from home, like a favorite blanket or stuffed animal, bottle or sippy cup, a change of clothes, and maybe a book or tablet for some fun while you wait. When you arrive, you'll check in at the front desk. Then, a nurse will call you back to get started. While waiting, feel free to enjoy the toys that are in the waiting room. The nurse will check your weight, temperature, and blood pressure. They'll also put a little clip on your finger called a pulse oximeter to check your oxygen level. It doesn't hurt at all. They'll also listen to your heart with a stethoscope, just like this. Next, you'll change into a hospital gown and get a bracelet with your name and birthday on it, just like a VIP pass. You will meet a few special people wearing masks and scrubs. That's to keep everything clean and safe. You'll meet your OR nurse, residents, your surgeon, and your anesthesiologist. The surgeon will come in and talk to you and your parent before the procedure. They may answer any questions you may have and let you know what to expect before, during, and after your surgery. They may also use a special purple marker to mark the area where they're going to do the surgery. The anesthesiologist, also known as a sleepy doctor, is responsible for keeping you safe and comfortable during your procedure. They will look into your mouth, listen to your heart and lungs, and also talk to you about how you'll go to sleep for your surgery. They may also show you a special anesthesia mask you will use to go to sleep. Sometimes you may also get a tiny straw in your hand called an IV. Older children typically will have their IV placed prior to their procedure in the preoperative area. They'll use a special numbing cream and place it on where they think they may put the IV. Younger children may typically have their IV placed in the operating room after they are masked to sleep. Before you roll into the operating room, you might get some medicine to help you relax. Some kids call it silly juice. It might make you feel a little giggly or sleepy. Now for the fun part. It is time to roll into the operating room. The anesthesiologist is going to roll you back to a really cool room. This room will have a lot of cool machines that beep, a special table, and lights that will help the doctors see what they're doing. In the operating room, they may also place stickers onto your chest and your finger, in addition to a blood pressure cuff. This will all monitor your vital signs while you are in surgery. After surgery, you'll wake up in the recovery room. A nurse will be there the whole time, checking your vital signs and making sure you're comfy. She may even give you some pain medication when you are uncomfortable. You may also get something to drink like apple juice or even eat a popsicle. Yum! If you need to stay overnight, you'll go to the pediatric floor or the pediatric ICU. The nurses and doctors will help keep a close eye on you and make sure you're feeling okay. You may also meet a child life specialist who helps support families during healthcare experiences. In the pediatric floor, you may also have the opportunity to play in the teen room or even the playroom for our younger kids. Some kids go home the same day. If that's you, you'll get dressed and maybe take a cool ride in a wheelchair to the car. Remember, everyone at the hospital is here to help you and make you feel safe and cared for. It's okay to ask questions or let somebody know if you're feeling nervous. You got this, and we'll be with you every step of the way. Thank you for watching, and don't forget to bring your snuggly friend and your brave smile. See you soon!